So tonight we're going to talk about overcoming children's fear and anxiety in today's world of uncertainty. Quite a long title. And what it really means is that tonight we're going to look at the effects of the quarantine on children, the quarantine that seems to continue to extend, challenges in the new normal, and one of the most significant parts, if not the most significant part, is moving forward and how do we provide strategies of support for the children in our lives, whether they're our own or our patients. So, there are numerous effects to quarantine. If you look at researches in the effects of quarantine on past disease outbreaks like the SARS, for example, or the Ebola, for example, they say that there's so much psychological effect that can happen on our children. I highlighted specifically here the uncertainty and the isolation. Often, because of uncertainty, that's why anxiety comes. Because of uncertainty and isolation, trauma can happen. Okay? So the really big words here are these: uncertainty and isolation. Now, when you're uncertain, you're put in a situation where you don't know what's going to happen. That extremely exacerbates feelings of anxiety, feelings of trauma, feelings of frustration, even feelings of fear. Not knowing, will me or my family get infected? Will my lolo or lola be safe? And isolation. We are social beings. The isolation and the lack of connection, that is impacting significantly on our children. And we'll see what the emotional and behavioral manifestations of these might be, no? And if you notice there's also grief. Why grief? Many of us, even the children, are actually grieving. Why? Because there's so much loss. There's loss of what used to make us happy, which is going outside and playing with the friends for children, going to Lolo and Lola's house, going to school and playing there, learning with my classmates. No? And for the grown-ups, there's also grief of loss of income, loss of connections, and so much loss that's going on, no? For everybody. There's fear, there's anger, and it has also been shown there's a lot of post-traumatic stress symptoms. We don't necessarily say it's a disorder immediately, but post-traumatic stress symptoms can definitely occur. Now, during quarantine, these things happen. Since the children are unable to go out, there's less physical activity and much longer screen time. Irregular sleep pattern and definitely less favorable diet, and there's minimal to no face-to-face contact with people we love or our friends too. So what happens then? There really are behavioral and emotional manifestations in our children and our teens. And actually, if you look back at, how things are in the household, for example, or what the parents of your patients might tell you on how the kids are behaving and what the kids are showing, we might then realize that, oh, this could actually be because of the quarantine effects. So let's understand first why these behavioral and emotional manifestations come about. All of us have needs. Children and our teens have needs. And when these needs are not met, like for example, the need to go out and play, the need to be with friends, the need to get into my sports activity, the need to join a contest or watch a movie, the need to connect with others. If these are not met, there definitely are feelings, negative feelings that arise in our children. And when these feelings of upset and distress are there then will be manifestations of these. There can be two main ways talaga of these manifestations. There are outward manifestations and there are inner. So the outwards, we call them externalizing behaviors. Externalizing behaviors are those that you really see. It could be shouting, it could be crying, it could be throwing things, it could be fighting. Those are externalizing manifestations. Then there are internalizing, which is going on the inside. And that's when children and teens withdraw. That's when they become quiet. That's when they're just there and they don't interact or talk too much. Okay? So let's try to see. What I did here was I categorized it, no, for the younger children, the school-age children, and for the adolescents, no, what the effects might be. There are similar effects, of course, but then there are also effects that are distinct to particular stages. Let's do the younger children first. The younger children, let's say anywhere between 2 to 6 years old, for example. These are the preschool, the toddler to preschool age children. What do we observe? Temper tantrums and externalizing behaviors can be very evident. Okay? When young children have a lot of emotions inside of them, sometimes they don't have the words to express it, but they feel what's going on inside. Like, for example, for us older people, if our chest tightens, we know that, oh my gosh, I think I'm a bit nervous, you know, or I'm anxious. And so I'm going to deep breathe. But for children, they feel it in their bodies. And sometimes they actually don't have the words for it and they don't know what to do with it. And so they will react because of these things going on inside them. And how do they react? They can throw tantrums, for example. There is frequent crying. There's a lot of fears. And definitely they might cling to caregivers, especially if the caregivers are frontliners or the caregivers really go out to have to do something. You see here repetitive play. The repetitive play that young children do in situations like this may look like what they're going through. Like, for example, I'm scared. Mama goes to work. She's a dentist or she's a nurse. And so when a child plays, the context of that play will revolve around that. And paulit-ulit yon. Bakit siya paulit-ulit? One, because they're trying to process it on their own. And two, because they're trying to express it and let it out. No? So you might see this repetitive play. There's difficulty staying still. So sometimes they say, ano ba to? May ADHD ba to? Ang kulit-kulit nito, ang gulo-gulo. But really, children will move when they're uneasy. When there's something going on inside them and they're unable to express it with words, sometimes just, they're just going to go around, stand up, play, run around. There's just a difficulty of staying still. Then regressive behavior, we'll see it. If a child is, let's say, toilet trained, might be that they'll start wetting again their bed, or even the older ones. If, let's say you're 5 or 6 years old and definitely way past toilet training, but then there can be bedwetting. Or for children, for example, who've learned or mastered certain skills, you'll find that, akala ko marunong ka na yan. And there's a regression. And back to the time when those skills were not very evident yet. And then definitely problems with sleep and nightmare, not a very rested sleep. So these are our younger ones. Now, how about our older school children? So this one is around 6, 7 years old to around 11 to 12 years old. Thereabouts, there can be aggression or defiance. Children are at this age, they often because they have a mind of their own, they're often wanting to show that I have my own ideas, I can do more things. And so this aggression that's stuck on the inside, these negative feelings that are stuck on the inside can come out as aggression or defiance. No, I don't want to do that. No, because I don't want to back away. And you'll notice that there's withdrawal from others and easily crying over the smallest things, when things didn't used to bother them, but then now it's a very little thing and then they start crying. Now, if you look here, there's repetitive behaviors. If it's the younger kids and we say it's repetitive play, repetitive behaviors can mean here something like washing my hands all the time. It's like an obsessive compulsive kind of behavior, paulit-ulit na behavior. Or can I just lock the door, open the door, go out the window, look out the window, wipe with alcohol, get wet once and wipe the door or the doorknob. No? It's repetitive behavior, especially when they're very worried and anxious, when they're anxious kids. There's anger. You see stomach ache and headache. Why? Because anxiety can be manifested in stomach ache and headache. A lot of children, when they have anxious feelings inside and they're unable to express this, they're the ones who often will say, "Awi tummy," or "I have a headache," but then there's no physiological reason for it. Difficulty in concentration or attention, and this actually comes into play when the children are back in school, which is pretty soon for most of our kids, and problems in sleep and nightmare again. This problem in sleep and nightmare really affects our children regardless of the age. No? So whether they're younger ones up to our older adolescents, that affected sleep is always there. So for adolescents, anger and frustration. So I work a lot with adolescents, and one of the things that really bothers them is the isolation, that they're unable to be with friends. Adolescents are very social beings. They love la cuacha. They love going out with their friends and talking and, wearing fancy clothes and stuff like that. And what's in? They're unable to do that now. There's anger and frustration, sadness, definitely a lot of worry. And some of them, they become lethargic. It's like some of the teens will say, "But there's nothing to do. It's the same every day. What's there to do?" And so we just stay in the bed. Stomach ache and headache also. And similar to our school-age children, there's difficulty in concentration and changes in appetite and sleep. So, that being said, what now will be the new normal that we are facing, and most and all of our children are facing? This is the kind of world that we've actually never experienced before, and everybody is adjusting to it. So the new normal will include these. This is not a comprehensive account of what the new normal will be. These are just some. And it's beyond the scope of this talk, not to talk about the new normal really, but we will focus on something that will significantly impact children and their families, which is a shift in education. There will be online classes, and for those schools that might have what you call blended learning, because they will allow, for example, certain days of face-to-face interactions, there will be staggered school days and smaller class size. I know of a school, for example, wherein they will have half of the class come in for a month, and then half will be at home doing online classes, and the next month that will shift. So it's a very different way of doing things. Okay, so now we focus on our shifts in education. What's going to happen? There's distance learning and there's homeschooling. Now, I purposely included both of these now because we need to differentiate them. Distance learning and homeschooling are not synonymous, nor can they be used interchangeably, no? Because they're very, very different from each other. First, what's distance learning? Distance learning really just means that instead of education happening in the classroom, it's happening here in my house. This is where I'm studying, but it's my teacher still from my school who's my main facilitator in learning. She or he is the main teacher. He or she will be the one doing the assessments and the evaluations also and giving me the grades. It's a remote kind of learning, and there's constant communication between the school and the learner in the house. That's distance learning. Homeschooling, on the other hand, it's actually a way of life. No? It's a different method of providing education. Generally, if not always, it's a parent or a primary caregiver who is the main facilitator of learning or teacher in a homeschool, for a homeschool environment or a child, no? And homeschooling kasi, what they generally do is they integrate it into life. So it doesn't always mean it's in front of computer. It could be that the cooking, for example, or the gardening, for example, or the painting that the child is doing, all of these are parts of the education of the child. So those are the two main distinctions when it comes to distance learning and homeschooling, that the facilitator is a parent or a primary caregiver, that the education is integrated into their lives. It's a way of life, no? And of course, they enroll also into a homeschool program. So we're talking primarily of distance learning here. Kasi kung homeschooling, generally, parents, it's a choice that they make for the homeschooler, no? But the distance learning or the blended learning also that's going to happen to all of our kids, that's something different. Now, we don't have a choice. It's the way it's going to be. So what are some challenges? The challenges are not only with us, but it's also with the school and with the teachers. So you see challenges in teachers' readiness, challenges of converting those lessons onto the online platform and ensuring that the children that we're teaching actually get it, no? And that we're able to assess, that they're able to assess the learning of the children based on the lessons that they deliver online. And of course, the infrastructure. Is there internet? Is the Wi-Fi at home good? Is there space? If there's no internet, do we get data? How's this gonna be? So, and that's not only for our children, but also for the teachers. Then there's childcare and monitoring, because parents will need to be working from home. Well, of course, others will not be working from home, but those who are, like me, for example, will need to monitor as well and see how my children are doing. Then there's the social, emotional, and mental health of our children, and productivity, focus, and attention in the home. Now, remember that one of the effects of especially long-term quarantine on our children is now a difficulty in focusing. It's a difficulty in attending. No? Plus, now that we're doing a shift to distance learning, that's going to come into play also. So what can we do with all of these challenges? We are going to focus for now on the challenges that our children experience at home, okay? Number one, of course, is the infrastructure. Ensure that you have what are needed. Check on the internet connection, make sure that the children are able to access. If the children are able to access, what then would be the next step? Are there available printed out modules that will be sent? Do we print out modules? Do my children have the device to use on their online learning? Do they have the laptop, the tablet, or a smartphone? What might they use? And space in the home. This is very important. I remember my daughter towards the end of the school year last year, she was 12 years old. And in the last couple of months, which is what they missed out on in school, no? After school was parang cut short, she would stay on bed and just, lie down and do Zoom on bed. And that was very difficult. And I said, we cannot do this. We have to set up a space, no? Set up a space, a table, a comfortable space where there's minimal distraction, a good chair, so that we identify this space in the home as a workspace. Because the bed doesn't really double as a workspace sometimes, because when we're in bed, it's really nice to just lie down there, and then if not lie down there, start looking at other sites that are not related to school. No? So these are very important, because psychologically it also has an impact that the child has this space that's specifically for work, and it's ready. There are pens here, there's paper here, there's notebook here, there's scissors here if there's needed, and anything else that's needed is there. And if he or she needs help, an adult is accessible to help out as well. Involve and set realistic goals with the children. This is very, very important, and I cannot emphasize it enough. Sometimes, kasi, what happens is parents or adults think that the children know what we expect of them. But remember that this is a very new situation. This has never happened to any of us before. And if it's a young child we're working with, even an adolescent, for example, it's pretty hard for them to actually know what to do and to know what we expect them to do if we don't tell them. So sit your kids down. We are all in this together. Sit your kids down and actually tell the children, this is new and it's not going to be that easy. There will be good days and there will be not so good days. How can we make this work and have more good days? Okay? And have realistic goals. Like, for example, Okay, I'll expect you to stay there from, let's say, this time to that time. If you need to go for bathroom breaks, water breaks, if you need to stretch, of course, that's okay. We cannot expect the children, for example, to just stay there. It's a school day baya. So it's like, whatever happens in school, that's what you're doing here. But actually, it's not like that. Do not recreate the classroom experience into the home experience, because they're very, very different. However, we will support our children when they are in our own homes, when they do distance learning. Right? It's a very different environment. So set realistic goals with the children. Make it very clear. When you set goals with the children, it is best to do it collaboratively. This is not collaborative when I say, oh, I expect you to sit there for for 5 hours, You can only stand up kung time na for lunch. And then after that, you get a break and then you sit down again, Okay, that's not collaborative setting of goals. And I'm telling you, that's not going to work. Why? Unless a child is involved in the crafting of goals or rules, the accountability becomes really low. Okay, what happens is the children will feel more accountable when they are involved in the crafting of these goals. So involve the kids. Let them have their say. Plot things to do. If you want to have, for example, like a board where they can pin the things to do for the day, then we can do that as well. Create a flexible routine. Routines are very, very important for the children. I'll preempt this by going to the next slide so I can read the routine, what the routines are, the importance of routines, and then I go back to the other slide. The consistency of schedules, predictable rules and consequences, and set expectations teach children how to behave, develop self-discipline and impulse control, and importantly, a sense of safety and control. And that's really what we want for our kids to have. When we say create a flexible routine, that means routine that can change. It is not a rigid routine. When we say, create a routine, but then, Mommy, parang I want to do this for a while. I'm feeling really tired. Oy, that's not part of our routine, Look at our routine. Oh, it's like this and like that. It shouldn't be like that, because allowing for flexibility, allowing for the child to move makes it more doable for the child and allows a greater sense of security. Take breaks and allow the children to move. Remember that these are young kids. Please, if there's time for a break and then they can like run or play outside with the dogs or run around for a while, do so. It's very, very important. The breaks actually make them think better, because when children are tired and they're just there doing the same thing over and over, they can actually lose focus and lose concentration. And taking a break and making them move, that makes them think better. Okay, that makes them able to concentrate also. Collaborate with the school and the teacher. Ensure that your communication lines are open. The teachers, the school, they're adjusting to this just as we all are. It's important to be patient with the teachers and the school, be patient with our children, of course, be patient with ourselves also as we are navigating through this. Communication with teachers are is very, very important. They will know what's going on and how you're feeling about all of these things and what difficulties you have and how they can support you too. Maintain a positive and collaborative relationship. A combative relationship will not be beneficial, not for the children, not for the parent, and not for the school at all. A collaborative one is most essential. And I like this next saying. I came across this now. And it said, in this extraordinary situation we find ourselves in, we must walk before we run. All these things are new to us. Before we can even expect that distance learning and the kind of education our children are having will be very easy and will flow naturally, and everything will fall into place. Before we even find ourselves in that situation, we have to go through a few glitches. And so that's why there's a need for patience for us, for our children, and for the school. Okay, how do we support children during these trying times? This part I like really. We are all going through a tough time, especially our children. They are being deprived of so much. But how can we ensure that our children get through this without long-lasting psychological effects, without psychosocial sequelae that will impact on them till adulthood? On how we can ensure that they grow up resilient despite what they're going through now. And that one I really super want to focus on, because there are so many children having a difficult time these days, and some of them are showing up in telehealth because of the effects of quarantine. And hopefully, with what we will be talking about tonight on the three main things that we need to focus on in supporting our children, we are able, the thing there really is to ensure that our children and ourselves, we get through this still whole, and healthy. So the three key points in supporting children's coping and resilience are this: physical and emotional safety, building and maintaining connections, supporting and teaching skills for coping and emotion regulation. Okay. The third one especially sounds highfalutin and stuff like that, but I'll teach you easy ways on how to do that. There is no better time to teach this than now, and there's no better time to practice it really in our children, in ourselves, and as a family than now, because these will really be helpful. Okay, let's go first to physical and emotional safety. Of course, ensure basic needs are met. Ensuring that there's food on the table, there's a roof over our heads, we feel safe and loved. If we have that basic, as a baseline, that's very important. Then we go to other things that will ensure physical and emotional safety. Reassure our children of their safety and our safety and the safety of people they love. We cannot, of course, say for certain that no family member will ever have the virus. However, that they know that we are taking the necessary precautions, that the recommended health guidelines, we're practicing them, the mask, social distancing, and all of that, that we are doing these and we're teaching them, then we are doing what we can to ensure our safety. It is very, very important to actually talk about it. In the next slide, we'll have a little bit more on this one. But ensure that the children feel that they are safe. Increase physical activities, have a balanced diet, and ensure regular sleep pattern. If you notice one of our first slides now, it said there that because of the quarantine, what happens is there's irregular sleep patterns, and children actually sleep late and late. And when I talk to different children, whether they're younger kids to adolescents, I find that some of them actually sleep at 2 a.m. and 3 a.m., wake up at 11 and say, oh, half the day's done already. And then I'm still feeling lethargic. So as much as we can, if we can incorporate it in the routines of our children, a regular sleep pattern, that's very, very vital. Please remember that lack of sleep, and especially lack of rested sleep and a difficulty in sleeping, if this keeps going on and on, it will eventually impact on the mental and the socio-emotional health of our children. It's very important that our kids get good sleep, balanced diet, and of course, as much as we can, if there's a skipping rope, if there's a game that we can play, if, we can walk a little bit there outside, then have some physical activities in place. Maintain or establish new routines. Some of the routines we have, they won't be applicable anymore. And so we establish new routines. And what I found out also is that our routines, it's like they keep evolving. And so that's why it's flexible. It's not rigid and it's not written in stone. Because maybe at a certain time, yes, we sleep at this time, and then we play with the dogs, and then we eat, and then we do this and we do that. And then after 3 weeks, 4 weeks, it changes somehow. The one here in the bottom went to the top, the one to the top went to the middle, and still it works. And that's fine. Huh? So our routines will most likely evolve as we go. But as long as they are there and our children follow it as much as they can, it's good to have routines in place. So here it is now, when I said that we'll talk about this one more. Honest, accurate, and developmentally appropriate information. People say, I've heard this many, many times, anything that's bad news, whether it's COVID, whether it's a death, whether it's, any bad news, the adults will say, let's not tell the children because, they'll get affected. They'll feel anxious. But actually, the contrary is true. When you don't tell them and they can sense that there's something, they will feel more anxious that they don't know what's going on. And the thing there pa is, if they don't know what's going on and they want to find out what's going on, they're going to go and search it online, and depending where they're at cognitively, where their cognitive development is at and how they understand things, whatever it is that they find online, they will understand it the way their brains allow them to. And sometimes it's a wrong way of understanding. Sometimes it becomes misconceptions. And sometimes it increases fear and anxiety all the more. So please know that explaining to our children honestly, using accurate and developmentally appropriate information about what's going on is helpful, is more helpful to them. It diminishes anxiety. It allows for information. It allows them to know what's going on. Okay? Now, limit exposure to media. With regards pala developmentally appropriate information, there's so much information about COVID-19, no? Whether it's storybooks, whether it's videos, whether it's like games or something from across different age groups, there's so much that are available and free online. Limit exposure to media. You've probably encountered this over and over again, because too much exposure to media, saying again and again what's going on and how many deaths there are, can actually be detrimental to a child as it is to an adult as well, no? Especially one with anxious tendencies. No? And so I have a niece. She is 8. She's turning 8 soon. No? And we were talking to each other, and I was talking with her mom as well, because her mom said, can you help me? Oh, what's happening? Because my daughter, she's extremely anxious. She can barely fall asleep. She's very scared of COVID and of everybody getting infected. But they're so very practicing all the health guidelines, healthcare guidelines that are being set. No? They're super practicing that. But how come she is extremely anxious about these things? Well, one, the adults around are always talking about it. And there's this almost 8-year-old who's listening to it. And if nobody explains it to her, she will get the feel from the parents, from the yayas, from the lolos and the lolas. And when they say, oh, look at this article on Yahoo or on Facebook, or did you see the news, and so on and so forth, it actually rubs off on our kids now. So we have to be careful. Manage your own stress and anxiety and take care of yourself. I cannot emphasize this enough now. And in a previous talk that I've done also, I made sure that this really came across to the parents, no, in the audience, and to the caregivers in the audience, no. Often we are taking care of our children and of the members of our family, and we are unable to actually take care of ourselves and manage our own stress. And just like everybody else, we are also getting stressed and anxious about the things that are happening. And this stress and anxiety that we're experiencing that might not be expressed, or that might not be managed well, what happens to it? Just like what happens to kids, it comes out in behavioral and emotional manifestations. So that means our fuse can become very, very short, and we can just, like, get upset, or we start shouting, or we withdraw, and we are unable to take care of others if we are unable to take care of ourselves too. And I think that we all have to be patient with ourselves, no? And be patient with ourselves, because often we are patient with others, but we need to be patient with ourselves because we're going through stuff too. Then there's listen, listen, listen. Allow expression of and validate feelings. And of course, there's play. I'll go back to listen, but I'll go to play for a while. Play, especially for the younger kids. My favorite play therapist, he said, toys are the children's words and play is their conversation. Allow the children to play, hopefully with real toys and not just gadgets. No. Play with them. Let them play outside. It's very important talaga to the physical and to the emotional well-being of our children. Now let's go to listen, listen, listen. Allow expression of and validate feelings. No? Our children sometimes say, Mama, I'm so sick and tired of this quarantine. I don't like it anymore. Nobody does. And so often, some answers might be, who likes it ba? Of course, it's so hard. Ay nako, never mind na lang. You have so many things to do there. Sige na. Ay, buti nga, you're safe eh. Look at all those other people, they're stranded and not safe and in quarantine. And so sometimes, what we want is for our children to see, no, that things are actually going well for you. No, so don't be too, drama by saying those feelings. But these feelings, they're very real to the child. And one of the best ways to support our children is to actually accept and validate that feeling. What does that mean? That means when a child says, Mama, I'm so sick and tired of this quarantine, I'm going to say, this quarantine is not easy at all. It's really, really getting difficult for you. That's a validation of feelings. That means it's okay to feel this. And once you give that to your child, the child then feels supported. The child then feels, so this is okay. So this is normal reaction. So I'm allowed to feel like this. Nothing's wrong with me. Because when I say, oh gosh, I hate this quarantine, I'm so bored out of my mind. And then the parent or the caregiver will say, ay nako, you have an iPad there? Tas may laptop ka pa? Tas may phone ka pa? Tas board ka? Dami mo kaya pwedeng gawin. That's, even if it's true, that they have all of these things probably, but if we want to look at emotional support, that is the last thing we want to say. Of course, we cannot validate feelings 100% of the time, because again, if we are stressed ourselves and anxious ourselves and bored ourselves, we might not be able, to do that all the time. Sometimes we snap and say things, but please, as much as we can, validate those feelings. Just before this talk, I was teasing my daughter, maybe you should sit down and, stay with me in the room while I'm doing the talk. Because it's like a very good example, because, we have good days and bad days, but today seemed to be not a very good day for my 13-year-old. No? And so she was painting, she was decorating her room, but she was upset. And she was saying, Mama, I don't like this anymore. And so what I did was I just validated her feelings, and so on and so forth, and helped her a little bit with the decorating of the room, and just allowed her to vent. And hopefully tomorrow or the next day will be a better day. Now, building and maintaining connections. When talking about resiliency, when talking about children and adolescents' ability to bounce back from difficult situations, there are 7 C's to that. One of the most important C's is connection. Connection is when you are able to find that person who you're safe with. And when I say safe with, you're emotionally safe with, because that person can feel you. We call it, you feel felt. Not only do you feel seen by that person, but you feel felt by that person, because that person accepts you and allows you to express. We need these kinds of connections. Sometimes these kinds of connections can be broken, but of course they can be rebuilt and they can be maintained. So spend time together. And when we say spend time together, that means as much as possible, especially with the younger kids or even with adolescents, there's what we call special time. Very, very important. That special time can be like 10 to 15 minutes in a week that you can have one-on-one with your child, and you plan it with your child. And on that 10 to 15 minutes, no gadgets, no nothing, no pagalitan, no educating, no nothing. The premise there is your presence as a caregiver of this child, or your presence as the parent of this child, is what is therapeutic and what is needed by the child. So you're just there. Let the child lead. The child wants to just sit down and not talk. It's okay. I'll sit down and not talk. I'm just going to be here. But that's very, very powerful. When the child knows that somebody's just really just there for him or for her, or with him or with her. So spend time together, connect with other family members online. You see a lot of this going on around, no? Families playing games together, saying hello to each other, doing Zoom calls every week, play online games, have virtual get-togethers and chat with friends. Encourage them to continue maintaining connections with their friends, with their teachers. It really makes a difference to them. I find also that some children are not comfortable with connecting with their friends through video chats, but they're okay through messaging. So that's a different way also, and that's fine. Connecting to a larger community. If your child or this patient is a part, for example, of an online art class, or has a church group that he or she is a part of, has a dance group that she used to go to before the quarantine, then continue to connect to this larger community. Now, here's skills for coping and emotion regulation. If you look at it, it seems parang, but that's so hard, no? Shouldn't a psychologist or a counselor be the one teaching this? You can teach this to your children, as well as we can actually do it ourselves also. Why is it important? When we're feeling anxious, when we're feeling stressed, try to catch your thought and see what your thoughts are. Often, when we're feeling anxious, when we're in distress, we are not thinking about the present. We are thinking about the past or the future. And so what makes us anxious might be, oh my gosh, dati I was earning like this, but now not anymore. Or, oh my gosh, I can't go and have prom with my friends. I can't go to the dance because of this quarantine and social distancing. And then that creates negative emotions inside. And then you start to feel your chest tightening. You start to feel your heart pounding and so on. No? So why mindfulness? Because mindfulness brings you to the present. It is not similar to meditation. It's not the same as meditation, but mindfulness is an awareness of the here and the now. And so when you bring yourself to the here and now, you find that, wait a minute, I'm okay in the here and now. I'm having a bit of a difficult time in the here and now, and still I'm okay. And so mindfulness is bringing things back to the present. How do we do that? There are a lot of grounding exercise. There actually are a lot of apps on this. There are even apps for kids on this. No? So off the top of my head, there's My Life, there's Headspace, there's Calm, there's Mood Flow. All of these are good apps, and majority of them are free also. So what are some ways that we encourage mindfulness? We connect it to relaxation and breathing. So I don't know, I'm just gonna very quickly stop the screen share for a while, and then I am going to show my hand. This is a very easy way to do mindfulness and to do breathing. I will teach my child, for example, how to breathe using my hand. So what do? This is my pointer finger. And what I do is this one, breathe in, going up. Stop. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. And you do it with all 5 fingers. And if it's needed, all 10 fingers. And when you do that, you tell the child, okay, just look at where your finger's going and just feel as it touches. No? Because when we allow ourselves to feel what's going through our nose, for example, or to feel the touch, or to feel our feet on the ground, like grounding, it brings us to the now and it relaxes us. Okay? So that's for mindfulness. That's for relaxation and breathing also. Aside from hand, you can also do star. You can also do square. A grounding exercise is when you say, for example, okay, let's try this. 5, 4, 3, 2, and 1. Be in this room with me right now. Be where you are right now. And tell me 5 things you see around you. Tell me 4 things that you can feel. Tell me 3 things that you can smell. Tell me 2 things that you can hear. Tell me 1 thing that you want to taste. And so that's bringing it to the present. These are, they seem very simple, no? But they're actually very powerful. And the more you practice it, the more the mind becomes relaxed and calm. And the more the mind becomes focused onto the present. So again, another one is teach healthy expression and management of emotions. We are able to do that well if we ourselves are able to do it also. So the first step, when you acknowledge emotions and you pick up on their emotions and say you're feeling really angry right now, or when I say, for example, I am feeling really upset right now because of this. I want you to do this, please. Okay? So that's a healthy expression and management of emotions. When you're angry and you use your words, if you need to walk away, you're going to say, this is too much for me right now. I need time alone. I'm going to come back and talk to you later. Or when the child is feeling angry or having a temper tantrum, there's no need really to shout and correct them at the point that it's happening, because nothing's going to happen. When a child is in a heightened state of emotion, when a child is having a tantrum, is crying, the best thing to do is to calm the child down. There's no teaching, there's no lecturing, there's no learning at that point. But connecting happens. Touch the child. If the child doesn't want to be touched because the child needs space, just acknowledge what's going on and that you're there. If a child throws something that is not a healthy management of emotion, teach the child what else to do. I don't like it when you throw. I can see you're very angry. When you're very angry, you can count 5, 4, 3, 2, 1. So you can relax, or you can turn around or walk away, or you can sit on your hand first so that you don't start throwing things. So we have to teach our children how to manage emotions, especially when they're young. it is not ingrained in them from birth. No? It is something that we need to teach them. So engage in positive activities, be the good. That means find positive activities for the child to do. Be the good means do something good. Even if it's preparing snacks for the garbage collectors when they come. Sending some food or coffee to the security guard. Packing little goodies for the children in the hospital. Doing those little things and knowing that despite whatever is happening, I can still make a difference. It's very, very powerful for children. No? And I think that's also part of one of the C's of resilience, contribution, that I am able to contribute for the good of others. Then give kids some space too. The way we as adults need space, our kids need space too. So during times when I feel that it's not a very good day, I give my kids some space. I give them an extra few minutes or an extra 30 minutes to an hour with a Wi-Fi or with a gadget, no, if that's needed for today. If it's needed that I'm just there not talking to them, because sometimes my daughter will say, I've had enough of this family. I've been stuck with this family for 4 months. And so like, okay, you can go to your room and you just stay there. Just let us know when you're ready. And that's fine too, no? Because it's really not easy. And I guess it's really just an understanding that different days bring different things. And we just need to adjust now, to be flexible to what's going on. Others. I wanted to include this, no, kasi there are many children in this population. Children with pre-existing mental health concerns, children with developmental concerns, and chronically ill children. The literature has a lot of information, no? And the World Health Organization is also saying that the next pandemic might actually be of mental health concerns, no? And children with pre-existing mental health concerns are at a very high risk for behavioral stuff or other mental health concerns that may arise, or even long-term effects of the quarantine. So if you know of children, if you work with children, if you have children in the house who have mental health concerns, please don't take it, pre-existing mental health concerns, please don't take it lightly. Be in contact with the clinicians that work with your children and that help in the treatment and support of your children or of the children that you work with, and ensure that there's continued support. Ensure that the child, if he has medication, continues to get the medication, has an opportunity to express himself or herself, no? Because they're at a very high risk. And children with developmental concerns also, who some of them might not even be able to express themselves, but are going through these difficulties also. Ensuring that the treatment plan or whatever the occupational therapy plans are for them, there's constant communication and collaboration with the teachers and other specialists that can work with them, even if it's online. Hopefully, we find a way to continue. If the children are not responsive to online, then it has to be that a caregiver or a parent is trained on how to do certain things, so that the interventions are continued even at home. And of course, there are chronically ill children also who are at a high risk, no? Because already chronically ill children have socio-emotional concerns and traumas related to the illness and healthcare experiences, and it puts them at a higher risk as well in this situation. So I end our talk tonight with a saying by Helen Keller, which I think is absolutely true. Although the world is full of suffering, it is also full of overcoming it. So we're all in this together, and I hope that there's something from this talk that you can bring home with you, and especially can bring home to your children or to the children that you work with, to make it easier for them and for you in these tough times. So thank you very much.
Thank you very much, Dr. Angie, for the very informative and eye-opening lecture. Okay, can you hear me very well, Dr. Angie?
I can, yes, thank you.
Okay, yeah. So we'll move to our Q&A.
Sure, yes.
Okay. Okay. For our first question, Dr. Angie, due to COVID-19, we are told to remove toys in our clinic. What can be done to help them, to keep them busy in the clinic?
Yeah, because of not only COVID and the infection control and stuff, no? Do you have iPads? We really have to either iPads, or if you have screens where you can show shows, that would be very helpful also. Also, another, if there's really no way for iPads, for example, and the children can bring their own iPads, or if there's no way for screens, for example, like TV shows and TV, so you can put in some shows, for example, is to prepare the children beforehand, before they come to the clinic. Tell their parents, prepare the children, okay? Inform them that there has been changes in the clinic. They will not be able to see this toy or that toy. What they will see is this or that. Could there be like a new figure, a sticker that you can put in there? Could there be an I Spy picture that you can put, and every now and then you change it? Pwede. Now, because in the hospital, when we work with the chronically ill, for example, that's part of the things we do. On the wall, we put I Spy stuff. And so they can look at it and catches their attention. And then we change it every now and then.
Okay, so really nowadays, communication with the parents,
Very
it's
important.
really very important. For our second question, Dr. Angie, okay, for families with 2 or more kids undergoing distance learning with different schedules, what suggestions could you give regarding workspace layout and work division to facilitate harmonious environment?
Okay, well, one, I don't really
This is
know
kind of
much
tough,
about.
especially for different cases.
Yeah, and also because I'm a psychologist and I don't know interior design very well. So, but anyway, um, I think it's beyond my scope to make a suggestion on what might be an apt learning space. Now, but what I can say is this, though. Number one is really to identify a space, no? And this is the key there. When you are able to sit down the kids and have a meeting with those kids, and prior to the start of the class, actually and collaboratively be certain spaces, who might be using these certain spaces at what time. If there are changes, we talk everyone on board, setting the rules and the goals together, and so everyone is aware, and then knowing who uses what. It's also best, no, if you have 2 or more kids in the house. Sometimes we don't have a lot of space, no, but even if it's just a small nook that a child can call his own and he or she is there, that would be very important for the child to identify that this is my space. Now, for example, ate is here, and then somebody is here, and then another one is there also, but there's a Zoom call. Is the person doing the Zoom call stepping out and going into the dining room to do the Zoom call there? Or are the 2 people who will not be doing the Zoom call stepping out and then the person staying there? So these are, I think, really arrangements to be done within the family. Depends also on the available space and the available gadgets that the family would have. But the key there really is involve your children in the planning, because the accountability increases, things will be easier.
I totally agree. Planning with the kids is very essential. For me, I have 3 boys, so I take your advice. I would really have to sit with all 3 of them to discuss everything with them. Okay, thank you for that. Another question, Dr. Angie. Do you think teleconsultation can be as effective as face-to-face, knowing teleconsult is advisable during this pandemic?
Yes, it actually is, no? And if you look at well, I am talking about telehealth consults with regards medical professionals and allied medical professionals, like my role, for example, as a psychologist, if you look at the literature, if you look at some researches, because I really like read some of the researches on that to know, no, na, will it be as efficacious as the ones that I'm doing face-to-face? And those that are in the literature actually say that, yes, it is efficacious, no? So long as, of course, the space is there, the things that are needed to ensure that it's a good place and time. There are no disturbances. You have good Wi-Fi. You are by yourself in your room, and all of these things. No, as long as these are all in place, yes, it is still as effective. And many practitioners have actually been doing online telehealth and teleconsults for many years, long before the quarantine even started. And I've seen its effect on the work that I do on the kids. No? So yes.
The question is, how can you calm a child and manage children during social distancing? Because we all know that calming them, touch is a part of calming them down.
Definitely. Mm-hmm. So if, for example, I am here and my child is on the other screen, for example, and the child is crying his heart out because we are unable to be together, something like that, right?
Yes.
Okay, sige. I've actually experienced this in a number of the children that I've worked with, no? And how do we do that? Aside from touch, there are different ways to calm children down. If you know this child well enough, whether it's a child that you work with or it's your own child, know what works for this child. For example, if this child loves songs, aside from reassuring, and since we cannot touch, talking, can we put on music? You communicate to the language that the child uses. Now, if the child is extremely heightened, if the child is crying and crying, one of the most important things is having an adult where the child is, calm the child down. Because as I said earlier, no, when a child is extremely emotionally heightened, there's really no teaching, reasoning with the kids, no? So have somebody else calm down the child where the child is at, and then communicate to the child in different ways, especially in a way that he responds to. And another thing that has worked very well is stories, especially when they're younger kids. Like, for example, a child that I'm working with, for example, is distanced from a mother. So what did we do? I recommend certain books, and then they'd read those books together online, because YouTube has a lot of books and they're read alouds and you can access that. And sobrang helpful. It eases the tension or the difficulty that the child is experiencing. No? So communicate in different ways. You can even play with a child online. There are so many games. If you want, I'll send Dr. Weng a document on all the online, not all, but many online games that can be played together, various resources. And this helps connect to the child, no? So that somehow it eases, no, the pain of the lack of connection.
Okay, I will be waiting for those games, and then
sure.
Maybe we can share it with everybody who wants to know those games as well. Okay, going to the next question, Dr. Angie. During this pandemic, we have seen kids spending more time with gadgets. How long should we allow children to be with gadgets, and what is the earliest age can we allow the children to use this gadget? The optometrist of my 6-year-old told me before that's only 1 hour a day, including TV time. But you know, that's really impossible right now. So what is your recommendation?
That's true. I think that if you go to the American Academy of Pediatrics, they'll tell you that any child under the age of 2 should not actually be on the gadget, except for doing, like, what you call this, FaceTiming with relatives and talking to relatives and parents and stuff like that, no? However, we have to admit really that the guidelines that were set previously by many of the, I guess, learned researchers on the effects of gadgets, they do not um, really work for us and for our kids now. No, as much as possible, there should, however, be a balance of um, physical activities, interacting with other people, and time spent with a gadget. Definitely, we advocate for that. However, we cannot say anymore now na, oy, 1 hour lang ha, kasi gadget is not good for you. Find something else to do. And this is what happens really when we say, oh, 2 hours lang ha, and then find something else to do. And then the child's like, what am I gonna do? If you actually tell the child, oh, 2 hours lang ha, and then find something else to do, give him suggestions on what to do. Ensure that the child actually has the resources to do other things. If you want him to do art, make sure that there's like an art table there with art materials that he can do that with. No, if you want the children to do gardening, make sure that there's soil or whatever else. No, so that's one. Sometimes it's a family values thing also, what is allowable and not allowable. But for the younger kids, if we're talking about the younger kids, as much as possible, there's a 20-20 rule. I don't know if you're familiar with that. 20 minutes looking on the gadget, 20 minutes to look away also, and after 20 minutes naman, sorry, after 20 minutes, 20 seconds, look away, and then after 20 minutes also, get up, stretch, do something else, and sit back, okay? Now, sometimes our children are on the tablet for 2 hours or 3 hours. The key lang there talaga is that you are able to monitor what they're doing. The way things are in the quarantine now, we cannot say just stay there for 2 hours and 3 hours. However, knowing what the children are doing, okay, you have an hour to do your games. Take a break, do something else. When you come back, 1 hour, can you do 1 hour or 30 minutes of learning something new? Like get into a site and learn about history or go inside a museum. So try to monitor the sites that your children are going into. Try to monitor the activities that they're doing online. Because I find that now, during the quarantine, it is not anymore so much. Of course, it matters still how long they're on the gadgets, but I found that what matters more is where they're going to, because they can really go to these sites that are not appropriate for them. No? So monitor where they're going, what sites they're going into. Find a balance between doing certain things even while using the gadget, and then another balance to doing physical activities, interacting with other people. Ultimately, the number of hours will depend on each family now, because each family setup is different. If two parents are both working and they have young kids, what can we do? We will have to let the children stay on the gadget if there's no yaya, So I think those are things that the parents have to make decisions about already.
Okay, the question is it okay for a child to skip this school year if he or she wants to, or for parents not to enroll their children due to fear of face-to-face or blended system?
Mm-hmm. This question can best be answered by what the family believes is right for the child. This question is best answered by what are the values and what is important to the family. If the question, though, is it wrong for the child to miss school? As long as the child continues learning in a different way, and if it makes the family more at peace and more comfortable, that the child stays home and does other things other than being enrolled in a school, that's a choice that the family makes. Of course, that's pros and cons, no? Kung whatever is, what weighs more heavily for the family also. But that's best answered by the values and what's important to the family. But if there's anything wrong, I don't think there's anything wrong if a family decides to do that for the best of their children. As long as keep your kids occupied, do something productive, and ensure that there are other things in place if he doesn't go to school. I'm assuming this is the question from Miss Mary and Uy here on the chat. Is this the one?
Yeah, in the chat.
Okay, because it was a little bit garbled. So I'm just assuming it's this one. It's fill in the blanks,
Yeah.
and it seemed to be this one. Okay. How can I help without offending the mom? Okay. Are you close to your friend? Because if you are close to your friend and you're scared of offending the mom, you can pass by your friend before going to the mom. No. If not, and if you want to go straight to the mom, the stance there really is not to tell them what to do. The stance there really is to provide options as a form of help on what might be possible things to things that are available for them to do. Now, when an individual with autism, for example, becomes physically violent, and especially if it's male and he's big already, that's very dangerous. It's dangerous to the self, to the child, to the person with autism, and also to the people around him. And sometimes we might actually need medication to calm the person down. No? So helping without offending would actually be offering help and just picking up on their experiences and describing it. Something like, I can see, Angie said it's been very hard. It seems that Michael has been hitting. So what I'm doing is I'm describing. No, I'm not going to say, oh yes, he's becoming violent. No, I'm not going to do that. Okay. However, I am going to pick up on possible emotions that are happening. I think it's very difficult for you, Mom. Yeah, I heard from Angie that it's become quite hard for you and you're really worried. I'll go that route, pick up on the emotions, describe behavior. Don't put labels, okay? Don't say, oh, he's violent, he's uncontrollable, he's ganito. Okay, no, none of that, because that can actually offend the person. So just describe. And then offer options. We don't say, this is what you should do para masolve natin yung problem. However, I can say, what might be options you think, Mom, no? Let's see, what has been done before that worked? What other things can we do kaya? Getting in touch with his attending physician might work. What else? And this one, and this one. Give options. And then they will decide on what to do. Very crucial, the communication there.
Okay, yeah, we have to be very careful with the words. Huh? Mm-hmm. Careful selection of words kasi really, it can really offend naman siguro, di ba? Even with close associations, no?
Very.
Okay, another...
Sorry, I was just gonna say, yun lang talaga. Emphasize on emotions, use feeling words, whether it's yours or the person's feelings. Number 2, don't use labels. Describe, describe, describe. And number 3, provide options. Don't say, this is what you do. Thank you.
Yeah, very, very nice words from you. Another question, Dr. Angie. Okay, some of us will try to give more to our children at this time, maybe because we want to show a bit of normalcy, like maybe online shopping for kids' toys and all that. Is there such a thing as spoiling your child during these uncertain times?
Parang lang bahay ko yan kasi my kids have learned Shopee that we've never done before
Same here.
Natuto tuloy ako, ay ganito pala ang Shopee. Okay, I learned something new during quarantine. Okay, again, I always go back to the values and the context of the family. I cannot answer for the family because I don't know what's important to them, what their values are. But this one, that is what I can say. In my family, for example, we've never done online shopping really, no? But my daughters had their birthdays in quarantine, one in May and one in June, and we can't go to the mall. And so we opted to do Shopee. And I'm just very careful because I don't like spoiling children. So in my family, what do? I will say, okay, this is my budget for you. Whatever else you want, beyond that, you have to pay for it. Okay? So that's a value that we have in the family, no? So for the person who is asking this question, or for whoever else might be interested in the question, it is a question that we also ask ourselves. How much am I willing to give? How much is enough? Even if I say, for example, okay, 500 ha, beyond that, sa'yo na. Tas iiyak siya. You can cry all you want. We had an agreement. It's 500. I'll wait till you stop crying. So the key there is, again, have an agreement. What is acceptable? What is beyond acceptable? What are the consequences? And even if you cry, I'll stick to what we agreed upon. Okay? But yes, I also agree that sometimes at this state that we are in, a bit of allowances. We are giving our children a bit more allowances than we normally would. And I think that's very needed. It's not even because we want to, but because our children need it and we need it. I think that our goal is to get through this quarantine safely, in good physical and mental health. And we want that for our children. And if that involves not spoiling them, but moving, our restrictions a little bit, because we're also appreciating the fact that they're trying so hard, then that should be okay.
So I will show your message to my children. So that way, when I set a budget, they will know that it came from an expert. Okay? Because sometimes it's really hard, diba? Anyways, okay. Yeah. Some parents use fear as form of emphasizing a point, like maybe scaring their children that they would die of COVID, when they go out or touch certain things. What's your take on this, Doc?
Oh, no, don't do that. That's one of the worst things you can possibly do. You're actually heightening the anxiety of the child. And even if, for example, the child is not showing it, imagine what's going on inside. Please remember that we are already in a state of uncertainty. We are already in a state of extreme isolation. And that child is not able to connect to others. And you are the source of security, stability, and safety of this child. The last thing you want is to shake the security and stability at this point when there's so much uncertainty and there's so much anxiety. What you want to do is to ensure that you are able to provide support and that your children are stable, are okay, are protected, and supported. Now, when we threaten our children, ako, baka mamatay ako kasi ma-COVID. Can you imagine what goes? Put yourself in the shoes of your child. I don't know how old that child might be, but put yourself in the shoes of the child. And the younger the child is, the more difficult it can be also. Kasi children from 2 to 6 years old are most vulnerable, when we say stuff like that. No? It doesn't make the child, if we use that to control and discipline a child, that's absolutely not going to work. In a talk on communicating effectively with children, one of the things that we emphasize on avoiding is threatening. It is not at all. It is very detrimental to children when we use threats.
Okay, point well taken, Dr. Angie. I hope the one who asked that heard you well. Okay, last question, Dr. Angie.
Yes, ma'am.
Okay, do not scare your children, please.
No,
okay, especially don't use the dentist to scare them.
Parang lang police. Susumbong kita sa police. Ayan na si Mr. Police. So pati pala dentist.
Yes, oo.
Dadalhin kita sa dentist.
Wag naman, please. Anyways,
yeah.
Last question, okay. Dr. Angie.
Yes.
How do you manage sleeping problems of children, especially when they're anxious at night?
Oh, yeah. There's a lot of that going right now. Okay, number one, we have to manage the anxiety first, because that's the one that actually makes the children not want to sleep or have difficulty in sleeping. How do we manage anxiety? Okay, please try to do the mindfulness, try to do the breathing. Please try to, if the child says, I'm scared, I'm scared. So we pick that up and we say, you're feeling really scared right now. Let's try to see how we can make that scared feelings go away. Let's blow. Or if what works for our child is watching funny videos, then let's watch funny videos, distract. So what we do is we equip the child, for example, first and foremost, on how to manage these anxieties. Don't get mad at the child if the child is scared and, I'm so scared, mommy. Ay, ano ka ba? Scared. Oy, tama na nga. That's not gonna solve it. The child's just gonna cry and the anxiety is just gonna grow, okay? Again, I know we can't do that 100% of the time, but as much as we can, if we're able to acknowledge the feelings and support the child, we do that, okay? So we manage the anxiety first. That's very important. Second, let's try to have some sleep routines. What might be sleep routines? Let's say the child goes to sleep at 9:30. So at 9 o'clock, what might our routine be? One child I know says she drinks a glass of water, goes up, puts essential oil so that it smells good. Okay, read a book, that's nice. Say a prayer, have massage, lie down with mommy. Okay, so establish a sleep routine that is, again, in collaboration with your child, so we know what might work for your child, and these routines may include both physical stuff, no? A massage, for example, drinking water or milk, for example, or even reading a book, no? Psychosocial stuff, reading a book, singing a song, saying a prayer, thinking about 3 things you're grateful for the day. Think about their favorite part of the day to end the day. So put in a sleep routine there. Now, if the anxiety persists and it's really affecting the child, please don't hesitate to consult a professional, because again, the last thing we want is, if the anxiety continues to be unmanaged, it's going to become even more difficult as the days go on, and it can impact the child as the child is older. Okay, so try to make a gauge of when you're able to do it by yourself with all of these recommendations, and when you think, it's not working talaga, it's time to consult a specialist.
Okay, I totally agree with you, Dr. Angie. Thank you, Dr. Angie, for patiently answering all our questions.
Very welcome.
For having you as a resource speaker. Okay, let me present to you the Certificate Incorporated and University of the Philippines, Manila College of Dentistry presents the Certificate of Appreciation to Dr. Angelita Sievert-Fernandez in grateful recognition of her participation as guest lecturer and for sharing her expertise and knowledge through the topic Overcoming Children's Fear and Anxiety and Uncertainty, given this 27th day of July 2020 during the PPDSI String of Pearls webinar series. Signed, Dr. Paul Plaridel Aguinaldo Abaya Jr., President, PPDSI 2019-2021, Dr. Danilo Magtanong, Dean, UP College of Dentistry, Dr. Rowena Cornejo Castro, Awards Committee Chair, Dr. Jean Arevalo, Officer Continuing Committee Chair. We will be sending you the certificate via email. Sorry, everything now is just online and all that. Okay.
I'll print it myself.
Yeah. Thank you, Dr. Angie. Hopefully someday we will be having you live and we can present
that would
to
be
you.
Nice.
Yeah, it's always a pleasure as always. Thank you very much again.
Thank you.
Okay.
Thank you very much, everyone.